People wake up on a normal day and suddenly something happens that changes their lives completely.
Paediatric trauma call, 15 minutes.
A lot of really bad things happen to really good people, but you never think it's going to happen to you.
Stabbed 5 times, including chest, and has got an arterial bleed from his leg.
High-speed RTC moped into wall.
Jesus Christ, what happened? You all right?
I love my wife.
Any reception, can I help you? Yeah, 24 hours, 7 days a week. I love that question. What's your opening hours?
St George's, London, one of the busiest and most advanced A&E departments in the world.
Complete baloney amputation of her leg.
I can't breathe.
He looks frail, doesn't he? He looks like somebody who's going to break. I think it's going to be one of those days.
A place where life,
Darling, what's for dinner?
love,
It's still as beautiful as ever.
We have a boy.
and loss
Don't make me cry.
unfold every single day.
And they said there's nothing they can do.
All the patients you're about to see were treated in just one 24-hour period.
You don't know how lucky I am to be talking to you right now.
We see situations where someone's life has just been turned upside down. People always try and remember what the last conversation was, or the last words that that person said to them. And I suppose it's so much nicer if the words that they remember are, "I love you."
Sat at George's again. I fell over in the shower.
Sorry.
The A&E department at St George's is run by a team of 263 staff.
Some people eat eggs but take the yolk out.
What's that? Oh, yeah, no.
I don't do that. No, that's weird.
I've got a lot of insight into the reception staff is because my daughter, the elder one, does some part-time work in the reception.
My dad has to do that because he has cholesterol, but it's so weird. Like, he makes me eat the yolk, and I was like, thanks.
Family keeps me sane, I should say. My daughters keep me in check. My wife tells me, okay, I will accept this, not this one. And I think that gives you sanity.
I feel like a right tramp. I've got a big baggy jumper on. I haven't brushed my hair. Haven't done no makeup. Oh well, coming to A&E is not a fashion statement, is it?
If you ring Resus on 1290. OK, bye.
Sorry.
Consultant Jay is in charge of resus today. He'll be supervising junior Dr. Sobi, who is yet to lead her first trauma call.
Resus, I think, puts your knowledge, experience, and skills to the test.
Trying to do 4 things at the same time.
Yeah, there you go. Welcome to a man's world.
Very funny.
My mum worked at George's, and she used to bring me into work with her when I was on holiday. So yeah, I used to hang around at George's quite a lot. Broke my arm and came here as well. I think from about 4 or 5, I thought to myself, no, this is what you want to do, and I was quite determined with it. So stuck to it, and I'm glad I did.
We're gonna get it a lot better in a minute, all right?
I treat all of my patients as if I would treat one of my own. I would give them the same amount of care which I would offer to any of my own family. Just going to gently lie you back a little bit flat. I know it's a little bit uncomfortable, okay?
Jay is incredibly calm and very patient. He's a good teacher.
All right, Shobs, when you're ready.
Okay.
Okay.
I guess that filters through when you're working together because it just means that things go a lot smoother.
All right. It's all done. The minute the red phone goes, you gravitate towards the red phone, whether you like it or not.
Hello, St George's.
It's a mix of emotions, but you're not really sure what to expect.
Yeah.
Not excitement as such, but more of an adrenaline rush.
Adult trauma call in 10 minutes.
A 65-year-old man is being brought to resus having fallen 4 meters from the roof of a house.
You want to run it?
Okay.
Okay, I'll stand in the back.
Jay has asked Sobi to lead the trauma team.
That was one of the first traumas that I led. It's a great opportunity, but it's a real test.
Shobi is going to run the trauma.
Roger was working on the roof of his daughter's house when he slipped and fell, landing on his back.
Your mind switches from being part of the team to being the team leader, so you have to kind of think ahead of everything that this patient might need. Very daunting to do.
On 3, ready, 2, 3. That's better. Oh, sorry.
This is Roger. Roger was doing some building work on a roof and he's fallen about 10 foot, just over probably. He was witness to fall onto his right shoulder, which is where he's got most of the pain. It gives him 9 milligrams of morphine.
No other interventions?
No, there's
Okay, thank you. Can we have a couple more people on this side to brace and one person on this side to just put the scoop in, please?
Okay, on 3. 1, 2, 3. Okay.
That's it.
Okay, 1, 2, 3.
Because of the nature of his fall, he could have had anything. A head injury, a chest injury, an abdominal injury, a pelvic injury.
Hold on, are you going to pull the Peter?
Yeah, we're going to put it out.
On 3, 1, 2, 3. Back down on 3, 1, 2, 3.
Thank you. They can have progressing injuries as time goes on, which can obviously change their outcome. So you have to act as quick as you can.
Can we have some more morphine, please?
Roger's wife, Ellen, has travelled in the ambulance with him.
Well, there was just a lot of trauma team around him, sort of wires going everywhere, and I wasn't in there very long because they told me to go into the waiting room.
Can you feel me touching your feet down here? Yeah. Any numbness in your feet at all? So we've established this pain in your lower back, in your right chest, and the right upper part of your tummy, as well as the very obvious pain in your shoulder.
Injuries to the chest could be life-threatening.
Okay, breaks off. Go.
These may not be overt. They do not reveal itself until you put them into a CT scan and actually pick them out.
It was horrendous, really, just things going through your mind, and the shock hit me then. It was horrible not to be there just to put it all right.
Retired builder Roger is having a CT scan of his whole body, having fallen 4 meters from the roof of his daughter's house.
Sorry, so that's it. It's done.
I heard Lisa shout that her dad had fallen, so I was up the stairs and through the window within seconds.
I just sort of called up and said, you know, we're having a barbecue. How long do you want? Do you want, you know, half an hour? And they were just like, oh, just give us 20 minutes. We're just packing up and everything. It was weird because I don't remember any sort of calling out. I don't remember. He just sort of landed like a sack of spuds.
Although he's retired, he just couldn't see himself sitting, doing nothing.
He was coming up weekly, doing the building and stuff. I pay him with love and food. He has helped a lot and done, you know, he's always put his bit in for us.
Anything to do with family, he will be there.
The guilt sort of kicks in. Thinking he was on my roof, if he wasn't, you know. You start asking yourself all those questions, you know, what if, what if?
I thought it might have been his back, more than anything. If his back had gone, then life would change completely.
Doctors will now have to wait for the full results of Roger's CT scan before they know the extent of his injuries.
Patricia? Yes?
Retired dinner lady Pat has come to A&E after a fall while out shopping.
Come and have a seat. OK, thank you. I'm Becky, I'm one of the nurse practitioners. What's happened to you?
I fell down the pavement. My legs on my hands.
And your chin, yeah.
Chin. I think my little finger's broken.
OK, so where's the worst pain? In the wrist?
Wrist and hand, yeah.
OK. Can you take this ring off?
No.
We're going to have to try and get that off before your hand swells up.
Oh, it's swelling up now because
yeah.
I can't get it off.
We'll try and get that off for you.
Okay.
And did you say this finger's
little finger,
got a problem?
yeah.
Do you want to slip your arm out the jacket?
Yeah, thank you. It's only my little finger that really hurt. Ouch.
That's painful.
Yeah.
OK. Can I have a look at this one?
Ah, this is the worst.
It's worse, is it? Sorry, darling.
Oh, I've got to hold it. It hurts.
OK. Is that sore?
Yeah. Ow.
In there?
Yeah, that's killing me.
That's worse, is it?
Oh, yeah.
I'm going to try and take that ring off before we send you down to X-ray. OK. Let's have a go with some gel first.
Ow.
Sorry.
Ow. Ow. Ow.
Oh, I'm sorry.
Oh.
Just get a grip on that.
Oh.
There we go.
Oh.
Sorry about that.
Oh, it's not your fault, is it? Oh, that bloody hurt. What do you think
Sorry
I've done?
about that, darling. I think you've probably broken something, but it's what you've broken.
Oh.
I think you've got enough swelling and bruising there and pain to make me think you've probably broken something.
Silly cow, ain't I?
Would you like another one?
Oh, I just said he can't.
Oh,
I just
sorry.
wiped him down.
Sorry, I'm just kidding. It's the last one, all right?
It's good for paramedic doctor because you're gonna feel better.
Yes. You know everything. Oh, you're clever, aren't you?
Yes, I am very clever. Ow!
Right, I shall take him for a walk somewhere. Right, come on. You're being really, really silly there.
5-year-old Patricia has hurt her arm after being pushed out of a shopping trolley by her younger sister.
Yes, come. Stanley, stop running, because you're going to hurt yourself again, aren't you?
Do you want to come in here? OK. And your daddy?
Yes.
Yeah, OK. What's your name?
Tom.
Tom. Yeah, take a seat, Tom. Yeah.
Thank you.
Tell me what's happened.
Well, basically, yesterday we went out shopping and She was playing in the shopping trolley, and her sister pushed her, and she just fell out.
Fell out of the
And
trolley?
yeah, and she has hurt her right arm.
Okay. Did she bang her head on the floor?
Well, the funny story is that we have tried a helmet on her head.
Okay.
Because we were about to buy for her bike.
Right.
And she had this helmet on, so
Really?
thank God for that.
So the helmet worked?
Yes.
And where is it hurting? Can you point? Just there in your shoulder it's hurting. Okay. Let's have a look at this shoulder. Does it hurt when I press there? That's where it's sore. Oh, you're very brave, aren't you? It looks like it's going to be broken. That's my feeling, the fact that it's not moving very well and it's quite bruised. But I'll go have a look. Yeah, I'll be back in a second.
It's been 2 hours since Roger fell from the roof of his daughter's house. Doctors are awaiting the full report of his CT scan. They're concerned he may have significant injuries to his spine.
How you doing? All right? He has a sensitive side. Very caring. He's always there for me. Always there for me. He used to be a bit harder, a bit fiery. Used to lose his temper if things didn't go right. I seem to hold my emotions in quite a bit. I suppose it's because I've been through too many emotional things in life. I hold them back. Just don't worry about nothing. After losing 4 of my sisters in such a small space of time, I think I've just closed myself down, really. The eldest, her breathing wasn't good. She had some sort of chest infection. Next day she was in the hospital, Christmas Day. She was on life support. And they turned her off New Year's Day. And then I lost the youngest. She just got a hemorrhage back of the neck. It paralysed her. She survived for 3 weeks. Just got my brother now. He comes over every Saturday, but he's not too well. There's 6 children, Mum and Dad. Down to just 2. With all the wires and everything else going on again, it just, yeah, brings it all back.
So she's fractured it.
Oh dear. How old are you?
She's 5. She's a brave little girl. She's so cute, actually.
Rubbish tidy.
Okay, we've had a look at the X-ray, and there is a small break. Small break. It should get better. It should be fine. But I'm going to speak to the bone doctors and just find out what they'd like to do.
Yeah, fine, thank you.
Just had a look at your X-rays. You've actually got a fracture in both wrists. Oh. Just chipped a little bit off of both of them.
All right. So what's it going to do?
Ideally, we'd like to put you in plaster cast.
I did stand up and my sister pushed me and I flew off
Your
from
sister
the
pushed
collie.
you? Oh dear.
Another doctor on duty today is Registrar Fahim.
I graduated back in 2003. I actually graduated from St. George's, which is great. One of my consultants said to me, oh, why don't you try A&E? And I was like, okay, fine. And I thought, yeah, this suits me. I like it. I want to do it.
We did blood cultures, yeah?
I owe it to my parents. My dad supported me, 100% all the time. Both my parents have really... Education was really important to my family. They're not highly educated, but for them it was always an aim to have all their children educated. And I think in the back of their mind they've always wanted someone in the family to be a doctor. It's just one of those things.
You're going to have to get this tomorrow. Okay, great. So I'm going to go and organise that. Okay.
Hello, Resus.
A 69-year-old man is being rushed to A&E. Richard, another retired builder, was found unresponsive and struggling to breathe by his son and grandchildren.
I come through the door and said, Dad, and he was in his chair, going, I'm all right, like he does. And I went over to him and I said, no, Dad, you're not all right.
We have something called a golden hour, and that's what we work towards, being able to get things done quickly.
Your call.
Okay, in 3, 1, 2, and 3. Well done.
Great, all right, let's have it.
Right, this gentleman is 69-year-old Richard. He was seen by his son, came around about 2 o'clock.
Right.
They found him in a chair, not responding to him, eyes closed, not even opening to pain. He's got this rash that had come on since Thursday when they'd last seen him, so between Thursday and now, he is known drinker. He's got some liver disease.
Who told you that? Did he or his son?
No, his son.
His son here?
He's got some medications on board as well that suggested that.
Anything you see on scene? Any blood, vomiting, nothing?
No, there was nothing. No, it's a reasonably clean flat.
Yeah. Richard, what's your surname? Any ideas?
Patients come in and they're septic, so they've got an infection that's so severe that we need to support them.
A nice line, bloods, venous gas, LFTs, clotting, the works. Thanks, bye.
Thank you very much. You're welcome, my love.
For a selfie.
High five. Very brave girl.
Thank you very much.
A 29-year-old man is being brought straight to resus from reception after doctors discovered he has a dangerously high heart rate. Musician Tad has a condition that causes palpitations. He needs urgent treatment to bring his heart rate down and avoid the risk of a stroke.
Hi. Hi, my name is Jay. I'm one of the A&E consultants. You are?
Thaddius, you can call me Tad.
Hi, Tad. So what happened?
This is a history that I've had for 9 years, since I was 20. It seems to be every 2 years it seems to drop into something.
Okay.
And I was just at home earlier on, just chilling out. No heavy night last night, had good sleep, all that, and just went bang like that. It kind of does a surge and then a big pulse. Best way to describe it would be a rumbling, if you can imagine a sort of a train running round your chest.
Any cold, clammy, sweaty features or anything like that?
These are always cold and clammy.
Okay.
It is unnerving. You know something's wrong.
Tad's heart rate is dangerously high, beating at more than twice its normal speed.
I'm not a big one for, somebody hold my hand. It doesn't do anything for me. I love my family very dearly, but I'm very comfortable in my own space, and it's me that's sick.
So what's your favourite instrument to play so far?
My favourite instrument is the bouzouki.
That Greek one that you said
Yeah,
about.
it's that.
What does it look like?
My one looks like a guitar, actually. It's a funny hybrid one. I've just had a new one made for me. It cost me $4.5 fucking grand.
You must get a good few gigs then.
I gig most nights, yeah.
Okay.
I'm a folk musician, but I specialise in playing Irish traditional music. I just find it a fascinating music, and I've never been one to follow the flock anyway. Everyone in my immediate family has chosen a career that has absolutely nothing to do with anyone else in the family. My aunt has become an expert in antiques. My mother went down a completely random route and's become an aromatherapist, and my dad has taught himself how to be an upholsterer. I've decided to go along and take the same attitude. This is me. It is my pot, and I will go and fill it with whatever I want, really.
Let's look at it. Good. Okay. All right, Dad.
Let's go for it. Rock and roll.
Nice deep breaths. Relax.
Tad is being given a heart medication to try and slow his heart rate. If this doesn't work, his heart might need to be shocked with an electric charge.
Oh, yeah.
Roger's daughter Lisa has travelled 30 miles from home to be with her dad. Roger is waiting to find out the extent of his injuries.
I think it's just seeing your dad laying there and, you know, sort of not being able to do anything.
Oh.
You feel helpless, you can't do anything. To see someone you love in pain is just really hard.
It's just an accident.
What's going on? Huh?
Both of them are very stubborn, and both of them are very emotional.
I don't like seeing you like this.
What's all this? Right? Come on, come on. It's not that bad.
She feels guilty.
Of course you don't. I know the risk. I didn't want to do it, I wouldn't do it.
We did quite a bit together when I was younger. My first car was a Beetle. We bought it for 500 quid and my dad did, you know, we worked sort of together on it. Obviously he did a lot more than I did. So, you know, so he sort of pursued that for me and we sort of, you know, got it sprayed and, you know, we sort of went out to sort of car sort of fairs, getting bits and bobs and stuff.
It's a bit of shock. It's coming out as always.
We used to go banger racing, those things. It's a lot of car stuff, you know, I'm not a girly girl.
Worse than me.
He cries at every soap opera on the television, so yeah, yeah, he's quite an emotional one as well. So I blame my dad totally, not my mum. It's all my dad's fault.
When my daughter got married, he was fine on the day, but for over a week he just couldn't stop crying. So he went to the doctor and he just said it was a build-up of emotions.
It gets better with age.
Great.
Hi, mate, it's me, Fahim. How are you? I've got a new one that came in. He was confused and found unconscious, well, reduced GCS by the ileus. He's come in now. His GCS is about 14 now. He's known to have cirrhosis, I think, and for what it looks like. He's very icteric and he's got jaundice, etc. So I'm just working him up now.
Doctors are worried that retired builder Richard is suffering from a serious infection and at risk of blood poisoning. His son Lee, his 2 children and partner Fran found Richard collapsed at home.
I've got to make sure Grandad's all right, haven't I?
Yeah.
Yeah, he's done it for me for long enough.
Yeah. So you got to do it now?
Yeah.
But you'll do it for us as well, aren't you?
Well, yeah.
And then we're going to do it for you if you get done.
Well, I hope so.
It's difficult because he's a stubborn sod to get things out of. So he'll never tell me when he needs help or if he's feeling unwell. He's always, I don't want to bug you and I know you're busy. And you don't sort of realise that I'm here. You know, yeah, I'm working, but you're more important.
Just look up for me, please. What are his eyes usually like? Are they a little bit more bloodshot, a little bit more yellow than they usually
They're
are?
not normally that bloodshot.
No.
They're usually yellow, yeah.
OK, cool. Fine. I'm just going to examine you. Is that OK?
He's been drinking since he was 16 and he's 70. I used to party a lot with the lads, drink a lot. I know he has drunk strong beer. He did get quite bad on it. I could turn around and keep nagging him to not have it, but he's 70. He's my dad. I can't tell him what to do. He's entitled to have it if he wants it.
And then this rash, is this a new thing or is it an old thing?
He's had it once before, I think.
And did they tell you what it was? Or?
They weren't sure. They just said to take antihistamines.
OK, fine.
All right, Dad.
When I was growing up, he was my mad dad. He used to do things with me my mum would tell him off for.
We're just going to have a little listen to your heart and your lungs, OK?
He used to take me over Putney Heath with my air rifle, and we used to shoot Red Bull cans and balloons, and once he'd cleaned his transit out, he used to put me on a skateboard and drive up and down the road. So, of course, every time he braked, I'd shoot forwards. Every time he accelerated, I'd shoot back. That was probably one of my best memories, that was fun. It just made you feel sort of special, you know. Oh, wow, no one else has done this.
OK, nice big breaths in and out through your mouth.
You blink and suddenly it's here, and I'm 10 years older, he's 10 years older, 15 years older. He's my hero, he's my dad. You don't expect your heroes to get weak.
So we do think he's got an infection. I think it's coming from his chest, but the only other thing we need to do now, we need to catheterise him, actually.
OK.
What that means is basically, so for some reason his kidney functions become abnormal.
Right.
And we're not entirely sure why. I think it was surprising when results came through. He did have an acute kidney injury, and it was relatively severe, and we were treating for sepsis. But it warrants further investigation.
Right,
so he's
okay.
coming in, but we need to do this so we can accurately gauge how much fluid is coming in, how much is coming out. OK.
OK.
What we'll do, we'll give him a broad spectrum antibiotic. I think he's got pneumonia, actually.
Not ready to lose him yet.
Junior Dr. Sobey now has the full CT report of Roger's injuries.
Because you landed on your right side and it was a fairly good going impact, all your injuries are on the right side. So from top to toe, you've got a fracture of the scapula, which is the bony part of your shoulder. And throughout your chest, you've got quite a significant number of fractures in the ribs. And they're fractured in 2 places, which is why you're having so much trouble with pain and breathing. The other thing is, along your spine, from about here to here, there are some fractures on the side of... So you've got the vertebrae and then you've got the bits that come off as well. Those have been fractured as well. The chest injury that he had was fairly significant, and it did need an inpatient admission and sort of management from the cardiothoracic end. Now promise me you won't be climbing on any roofs.
Not for a little while. No, I won't let him. He's banned. Full fries, that's to keep you going.
Roger needs to be closely monitored on a ward before doctors know if he'll make a full recovery.
Doesn't feel like it's shifting anything, lads.
No, it isn't.
Medication has failed to reduce Tad's heart rate. Jay will now try to shock Tad's heart into a normal rhythm.
What did we get it down to, the old rate of Rooney? Just out of interest. Did it slow it down at all?
Nope.
Groovy. I've got a strong heart, man. Don't mess with me. I might turn green.
Hi, Miss J. 6 and 12 didn't touch him. Nothing. Are you happy for me to electrically do it? Yeah. Okay, fine. Because it's beating irregular and it's beating fast, it has a tendency, if you leave it untreated, to form what we call as clots. And these clots can actually get thrown out and they can cause strokes.
What would be the port of call if this doesn't work?
Now, usually it works by and large. If it doesn't work, you come around and then we'll give you some medications to try and see if we can slow you down.
Hello. Hi. My name's Sadie. I'm one of the doctors.
So Shobi is going to help in the senses because we prefer to have 2 people on because we're going to give you some sedation to put you to sleep.
Good idea.
While we're doing it. It doesn't put you off completely off because we're not putting a tube or breathing aid tube or anything for you. So it makes you safe enough in a sleep so that you don't feel what's happening, and then we try and give you this
or something, isn't it?
Yeah, and then you come around from it.
Sweet.
Okay?
Yeah,
so
cool.
that's the plan.
29-year-old Tad is about to receive an electric shock to try and correct his dangerously high heart rate.
I'll join you guys on the end of your shift for a drink. It's going to be cool. It's going to be great.
Sounds good.
Okay, yeah, that's much better. Fine. I'm going to put this on.
Hooray.
Okay, it might smell a bit funny.
Well, what is it? Is it funny? Is it funny stuff?
No, it's just oxygen. Is it funny stuff?
That's what you're getting through your being. Tell me when. Are you ready?
Yeah, everyone's happy. Are you shocking? Okay.
Yeah?
Yep. You do have to have people around just in case something does go wrong.
Just relax. Relax, Tad.
Not just to the patient, but also to your staff, because they can inadvertently get shocked themselves.
Tad will experience a shock of around 800 volts surging through his body.
I was scared. You are being electrocuted.
How are you doing, Tad?
Well, here.
You ready?
Oh! Sorry.
No more. Just fluids. You can open your eyes, Tad.
Well done, mate.
All done. Worked well. I told you.
Yeah, it's done.
It's all done. All right, just chill out and relax, okay? The Bollinger is coming.
Oh, you speak my language.
You are funny, you know that, Tad.
Well done, Truth. You're all welcome to my gig. Drinks on me.
Sophie.
Sophie, you're a legend, Sophie. Thanks very much.
You're welcome.
I've had some of the scariest moments at St. George's Hospital, but they've always been responsible for fixing me. I've been saved, literally, by nurses in the past. I have 100% admiration for them. I've known a few nurses in my time that worked in A&E at that particular hospital, so we need not dwell on that subject anyway.
Listen, thanks a million. And
I didn't do anything, I was just...
someone that's good to chat to, because I know that I'm quite jovial, but, you know, deep down it's scary. So, you know, cheers.
Yeah, no, good to meet you, Ted.
You too, take it easy, dude.
Yeah, you too.
But as soon as they fix you, you're back rolling.
Someone needs a high five.
All right, then. I'll have it.
All right, buddy. What do you think?
I'm hoping that after a couple of hours of observation, I can get you home.
That'd be fucking sweet.
Richard has been given a concentrated dose of antibiotics to try and fight the infection in his bloodstream. Doctors will need to monitor him closely over the next few hours.
Due to the sepsis, he hadn't been eating or drinking. All these things had had an effect, and that would have just made things even worse.
Oh, God. You're the best guy in the whole world.
Thank you, mate.
Stephen's not biologically mine, but I've been there since he was about 18 months. He loves building things, loves his tools, always watches me when I make things.
Like a girl's way.
Kyla, yeah, she's beautiful. She's just beautiful. She's got little ringlet hair. She's got a laugh that just goes straight through you. It's brilliant, you know. If you're feeling down, she'll laugh and you've just got to smile back at her.
I don't have to keep this on for when I see Grandad, do I?
Yeah. Yes.
I just say to my dad, if I can be half the dad you were to me, then I'll be a proud man.
We could do in and out. So with the SIRS criteria, so he did fulfil some of it. But he's been responsive to fluid, so his blood pressure's come up. I find it personally really quite difficult when family members aren't very well. It is really hard for me. It's strange that they didn't have to say anything, but you could tell there's a bond there. When you do have that kind of rapport, when you see that interaction, family interaction, you know, you feel it, you understand it. I mean, that's what life's about, really.
The kids have done you a get well card.
I have, yeah?
Yeah, they're out there.
Really?
Yeah. You're sounding a bit better now. You're making sense now.
Am I?
It's a little bit better to you.
Yeah, he's making sense and...
He come and rescued me. Saved my life, really.
Don't worry about me. Of course I worry about you. You're my dad.
I used to live next door to a pub. You knew everybody. You used to buy the whole round and then they would take turns to buy one back. So you might have 6, 7, 8 pints. You always think you're young, but your body wears out. And then you just can't work anymore. I suggested he went to a private school, which he did, because I didn't want him climbing ladders, lifting heavy bags of cement, getting dirty, pulling ceilings down. Just do something better than me.
Nonsense. No, you're not dead. I've put you through worse.
It just couldn't fit in because we was not in the right class of people.
Soppy git, you need to go to the doctors a bit more.
I wish he, you know, wouldn't be so stubborn. Because if we hadn't got there this time, I'd rather not think about that. Turns out you had one of the worst pneumonias you can get.
Kid, Grandad's getting better.
They love him. Grandad Richard, he turns up, they always go through his bag. He's always got chocolates and sweets and toys.
Well, we've got to get the kids home and fed.
Oh, no, you must.
Yeah. They're just waiting for a bed to take you onto a ward now. All right. Do you want to give Grandad a kiss before we go? Yeah?
Uh-oh.
It's all right, stay there. We'll bring the kids to you.
Oh, yeah, no, kitties. 3, 4 years old, I probably won't see her get married. Or the boy go to university.
Oh, why did I get the heavy one?
Oh,
Good
lovely,
boy.
lovely.
Bum.
I'm going to try, though.
Right, love you, and please behave, and call us, all right?
Nice.
Next time, don't leave it so bloody long.
I won't leave it long.
Next time you come home with us and I'm not taking no for an answer.
Oh.
from rest, Dad.
Love you.
Love you.
Bye.
I did turn around later that night after I said, you know, that Grandad's quite ill. I said, but, you know, you two saved his life. You two are superheroes.
Hello.
How are you doing?
How are you doing?
Good, I'm Leela, so I'll be looking. I'm just taking
Gotta
over
be careful.
from Joe.
You're the kind of good-looking girl that's going to put my heart rate back up to 150.
You've definitely woken up.
They didn't warn me about this, and I should cover up. I'm feeling incredibly embarrassed.
How are you feeling?
I'm feeling a lot better now. You just popped in.
Glad I can do something to help. Your heart rate's come down nicely.
Yeah, it has, for the moment.
For the moment. Just keep it that way.
Yeah, you better leave. This is, yeah.
Hello, Amy Resus.
He bought himself a little car to tinker with. He can't just sit still and do nothing. It's not in his nature.
I don't like things being too easy. Like, you know, I like a challenge.